Good afternoon, and welcome to our special International Women's Day webinar series presented by Apollo Hospitals. I'm delighted to be your host for today's session, which focuses on an important and often life-changing medical procedure, hysterectomy. It is my pleasure to introduce our distinguished speaker, Dr. Sumana Manohar, Obstetrician and Gynecologist at Apollo Hospitals, Chennai. With years of experience in women's health and minimally invasive gynecological surgeries, Dr. Sumana has guided countless women through complex reproductive health decisions, helping them regain quality of life. Dr. Sumana, thank you for joining us today. This session will be divided into two segments, a 30-minute question answer by Dr. Sumana, followed by a 15-minute live Q&A where we'll address your questions. So let's get started.
Hi.
Hi, ma'am. So one of the first questions we have today for you is, what is a hysterectomy and why might a woman need one?
So basically, hysterectomy is removing the womb, which carries the babies all the years, and also plus or minus removing her ovaries. That's what the hysterectomy. There are several types of hysterectomies, like radical hysterectomy, simple hysterectomy, etc. Depending upon the indication, we have to go ahead with it. Simple hysterectomy is where we remove the uterus with or without the ovaries, and including the cervix. When we call that as a subtotal hysterectomy, that is when we leave the cervix and just remove the uterus.
Now, what are the different types of hysterectomy procedures?
See, the hysterectomy, the uterus can be removed in several ways. So one is by total abdominal hysterectomy. So the uterus is very large and cannot be done laparoscopically, or there is any risk of precancerous conditions. In those situations, we have to do an open surgery and remove the uterus. That's called the total abdominal hysterectomy. The other method is laparoscopic hysterectomy, where through a keyhole surgery, we look at the uterus and both ovaries and will remove the uterus abdominally, and we remove the uterus, rescue the uterus from down below. That is laparoscopic hysterectomy. Robotically also can be done when there is an indication. So robotic hysterectomy also is another way of removing it. There are other methods like V nodes, where vaginally you can approach and remove the uterus. So there are several ways of peeling a banana. That's how several ways of removing the uterus is there.
Now, what are the indications for robotic hysterectomy?
So when there is an indication for hysterectomy for benign pathology, say for example, she had a fibroid or she had abnormal uterine bleeding, which is not responding with the medication or with the conservative surgical modalities of treatment, that's when we have to go for a hysterectomy. So laparoscopic hysterectomy and robotic hysterectomy can be done. Both are of same caliber, but with robotic, the pain is much lesser and the vision for the vision for the surgeon is much higher, because you get the depth perception as well. And same way, the 3D laparoscopy also, which is available, that also gives the same perception of the uterus when we remove it. And it's the perception and the way we remove it. If you have a difficult surgery, for example, endometriosis or a larger fibroids or very precision surgery, then robotic can be used. Otherwise, laparoscopy also can be used.
Ma'am, in your expertise, what are the common medical conditions that lead to hysterectomy?
Yeah, so normally around the perimenopausal age group, say around 40, 45 to 50, when they present with different conditions like abnormal uterine bleeding, where they do not respond with the medical treatment, they do not respond with the hormone-releasing IUCD, then we have to go for a hysterectomy. The other common condition, what we see in India, is adenomyosis, where when they had cesarean sections, previous cesarean sections or previous abortions, medical terminations, where the lining of the womb gets deposited outside the lining in the muscle ace of the womb, and that causes severe pain and bleeding. That's when they need hysterectomy. That's for adenomyosis. And the other conditions like benign tumors of the uterus, like fibroids, they need hysterectomy sometimes if they're not responding with the medical treatment. And also if they are distorting the anatomy inside the lining of the uterus, where they have profuse bleeding, not responding with the medication, and they have larger fibroids, which are distorting the anatomy and giving pressure when they pass urine, pressure when they pass motion. And this are called symptomatic fibroids, that's when we have to go ahead with the uterus removal. The other condition is endometriosis, where the lining of the uterus gets deposited outside. Whenever there's bleeding inside the uterus, it also bleeds outside. That's called endometriosis, which can happen and which is very painful again, and they have heavy menstrual bleed and extremely painful periods. Those are the conditions where they can have. And the other important condition where simple hysterectomy is indicated is as in a precancerous conditions, when they have something called CIN1, 2, before it turns into malignancy, that can be prevented to become malignant by removing the uterus. These are the few conditions where the uterus needs to be removed or hysterectomy is indicated.
Thank you so much, ma'am. What are the diagnostic tests that are conducted before we determine if a hysterectomy is needed?
Yeah, the first and foremost thing is when after a 40-year-old or a 45-year-old, when they present to you with abnormal uterine bleeding, you need to get a hysteroscopy and a sample of the lining of the uterus. It's called endometrial biopsy to make sure whether it is normal or pre-malignant or malignant. If it is pre-malignant or normal, then you can go ahead with it. That's very important. And a pap smear, cervical pap smear test is important to look at the cervix. And these are the two important factors before we go ahead and contemplate on removing the uterus on somebody. That's number one. Number two is the pre-operative investigations like the routine blood investigations, X-ray, ECG, and echo, depending upon the patient's condition. Then we have to do those investigations as well. And it's very important that we know about the hemoglobin before we go ahead with the surgery, because we need to know whether she needs any blood transfusion during or pre-operatively. So these are the few investigations we have to contemplate on doing. But as I said, I insist on a pap smear and also an endometrial sampling before we contemplate on hysterectomy, especially when there are more than 40.
Ma'am, there is a total hysterectomy as well as a partial hysterectomy. What are the indicating factors which will decide whether we should go for a total hysterectomy or a partial hysterectomy?
Partial hysterectomy is nothing but a subtotal hysterectomy where the cervix is kept intact. So these are the conditions where the cervix cannot be removed. It's better that we go for a total hysterectomy most of the time, because there are conditions where the cervix is really stuck with the bladder and the bowel, and it's more dangerous, and there may be possibility of injuring the bladder or bowel. Then the subtotal hysterectomy is indicated. And especially when we remove the uterus postpartum after the delivery, sometimes we may have to go for a subtotal hysterectomy. Otherwise, total hysterectomy is indicated because removing the cervix is important. There are advantages and disadvantages of it, but the advantages are that you're preventing cervical cancer and there's no need for cervical cancer screening. Whereas if you go for a subtotal, then you have to go for a cervical cancer screening like a pap smear on regular basis, which is very important. And also sometimes they will have some sexual issues when they go for a total hysterectomy, because the cervix is not there, the pleasure may not be there, is the contention what people have.
Ma'am, does undergoing a hysterectomy affect hormonal balance?
If you remove the uterus, and normally along with the uterus, we remove the tubes as well, because it's called risk reduction surgery, where the risk of ovarian cancer is reduced by removing the tubes. Okay, so when we do this, sometimes the ovaries may have a lesser blood supply and they may go into premature menopause. And sometimes when we remove the ovaries, yes, they do have the risk of having a surgical menopause, we call it, where they can get into menopause, and it may affect their bone health and the cardiovascular system as well. And also other things like the vasomotor symptoms like hot flashes, hot sweats, and having sexual issues, having urogenital symptoms like passing urine will be difficult, and burning sensation when they pass urine, and burning sensation or when they have relationship, all this can happen. So it's very important that we do not remove the ovaries unnecessarily. If there is an indication, we have to remove it. After the age of 45, you have to discuss with the patient and give her the options of removing the uterus and not removing the ovaries and not removing the ovaries. And take it further, and if there is any family history of cancers like colonic, breast, ovarian cancers or endometrial cancer, then it is right. If they had a history of breast cancer, yes, you have to remove the ovaries. Or if they're 49, 50, and there is an endometrial pathology which warrants ovarian removal, yes, we have to remove the ovaries. Otherwise, better not to.
Ma'am, does giving the patient hormone replacement therapy help them alleviate the symptoms in any way?
Yes. So if there is a patient who had endometriosis or who was 49, 50, and we have removed the ovaries, yes, it does. See, the postmenopausal ovaries also will produce androgens, which are good for the bone health and also for the symptoms, menopausal symptoms. So those patients, yes, if there's no contraindication, hormone replacement therapy does help.
What are the potential risks and complications of hysterectomy, ma'am?
Any surgery carries a risk. There is a small risk. So when we remove the uterus, the surgical risks, what we have to, unnecessarily, we shouldn't be removing the uterus. There should be a strong indication, especially if there is no response to the medical treatment or there is a good indication to go ahead with the hysterectomy. That's when we have to contemplate on removing it. See, when we go for surgery, any anesthetic risk can be there, and surgical risk if they had previous surgeries like previous cesarean sections, endometriosis, all these patients will have adhesions inside, uterus adherent to the bladder or uterus adherent to the bowel, and all those things will be there. So there is a small risk of that. And we do laparoscopy, the laparoscopic complications like secondary to the pneumoperitoneum, the gas what we put in, and also the other complications like a small injury to the bowel and bladder can happen.
What are the
And
lifestyle?
the other important thing is, sorry to interrupt. The other important thing is the psychological aspects. When we remove the uterus, we have to psychologically give them good support so that they don't go into depression and they don't go into psychological issues after.
What are the common psychological issues that we have to counsel for a patient advised hysterectomy, ma'am?
So they should say that we should tell them that it is an organ which needs to be removed. There is a good enough indication to remove it. It doesn't mean that it will cause any issues for you. So if you are removing the ovaries, then if there is an indication, we have to support them with the hormones. Few things are like, they are very scared that the sexual issues can happen, depression can happen. And sometimes they think that everything is lost once the uterus is out. So that's not the case. If there is an indication, if it's going to be detrimental to your health, I think it's better to come out rather than being there.
What are the lifestyle changes that you would advise for a patient who has had hysterectomy, ma'am?
Yeah. So if she had a hysterectomy, first 4 weeks, we have to be a little careful and they should avoid a sexual relationship. And also they have to rest out. This is the time when they can rest, honestly, the women at that age group where they have lots of midlife crisis. So it's better that they take things very slowly the first 4 weeks. Later, they have to exercise regularly, especially if they had removed their ovaries. It's very important to prevent osteoporosis, to exercise regularly and have a healthy eating habits so that it doesn't land them in some other issues.
Ma'am, as you mentioned osteoporosis, what are the different treatments or what are medications that we offer the patient to prevent osteoporosis in case of hysterectomy?
So when there are several methods. One is when we remove the ovaries and the uterus to prevent, first thing is lifestyle. So you have to exercise regularly, which prevents the bone loss, and also healthy eating habits are very important. Lessen the fat and lessen the sugars, all that, which will help for the heart and also for bones. So the other medications are hormone replacement therapy. If there is no contraindication, there's no family history of breast, ovarian, colonic cancers, there's no contraindications in the sense she doesn't have a contraindication to go for hormone replacement therapy, like that her uterus has not been removed because of some pathology in the uterus, yes, then they can go for the hormone replacement therapy. They can go on the estrogens, long-term estrogens, they can go on it. But before they go on it, you have to make sure her mammogram is normal, her liver functions are normal, her cholesterol is normal, hemoglobin, sugar, urine, thyroid, all these investigations are normal before she goes ahead with the hormone replacement therapy. And there are other things like soya-rich food. They can have more of those foods which are higher in soya and higher in estrogens that also they can have if there's no contraindication. There are medications called phytoestrogens which some people use. We should not be using it because we don't know how much of estrogen is getting into the body. So there is a small increased risk of breast cancer in those cases. So better not to use phytoestrogens.
Ma'am, we've noticed that there are common misconceptions about taking additional hormones, and there are a lot of fears and myths related to taking hormones. So, how do we elevate those fears in those patients? How do we counsel them?
Yeah. So basically, if they need hormone replacement therapy, then depending upon the indication, say there are patients who have perimenopausal age group, from the age of 45 to 50, they have irregular cycles and they are in highly placed positions. In those patients, definitely they need hormone replacement therapy to move on with life because they cannot cannot stand still because of this lack of hormones. So those patients, they really need cyclical hormonal therapy. They need to be regularly monitored with the transvaginal scans and the mammograms and also the blood test so that they can move on with life. And there is no harm to it unless you use it for 5 to 15 years of hormone replacement therapy. There's no major harm of it causing cancer. So it can be regularly monitored and it can be taken.
Thank you so much for that, ma'am.
That
So,
is an indication.
what are the lifestyle changes that a patient should follow post hysterectomy so that they don't get affected by the lack or the fear that they have had a hysterectomy?
See, meditation, yoga, and also healthy eating and exercise. Isometric exercises really help to increase your bone strength. So those are the things which they have to carry on.
Ma'am, what are the long-term, exercises that you would recommend for a patient who has undergone hysterectomy? There might be a fear of incontinence or something of that sort in a lot of patients, which they, use as a fear or a crutch to not undergo a medically required procedure.
See, the urinary incontinence is not secondary to hysterectomy. If they had menopausal symptoms of the lining of the urethra, the urogenital area gets thinned out because of lack of estrogens, they need local hormones to combat that. And exercises, pelvic floor exercises really helps, especially as you get older, so that you strengthen the muscles and the stress incontinence, when you cough or sneeze, you dribble, those will be on the lesser side, and prolapse of the uterus, that will be on the lesser side. You should never get constipated. That's another reason why they can get all these issues of prolapse and urinary incontinence can happen secondary to the prolapse. So these are the exercises. Otherwise, walking, 45 minutes of walking every day, 30 to 45 minutes of walking is good enough. Pelvic floor exercises, isometric exercises are good enough.
And what are the long-term effects of hysterectomy on the bladder and bowel?
Not a major effect of the hysterectomy on the bowel or the bladder unless you remove the ovaries where they get into surgical menopause and they have the menopausal symptoms like urgency, urge incontinence, and also wanting frequency, going to the toilet on frequent basis. All this is because of the lack of hormones, which can again be combated if there is an indication, there's no contraindication by local estrogens.
Ma'am, does hysterectomy affect menopause? Does it bring on an early onset?
If you remove the uterus and leave the ovaries, you can get into menopause a year or two early because you're actually disconnecting the blood supply to a certain extent to the ovaries. So they can get into premature menopause by removing just the uterus.
Ma'am, I have a few questions from the viewers as well. So one person asks, I have been diagnosed with fibroids, but my doctor suggests waiting. How do I know when it is the right time for hysterectomy?
Yeah. So fibroids are a younger age group. It's not a problem. Fibroids are symptomatic fibroids that need to be removed. Say, for example, you're trying for a baby and this fibroid is distorting the cavity of the uterus. It's big and it's causing recurrent miscarriages. Yes, you need to remove the fibroids alone. After the age of 40 or 45, anybody who is normal looking fibroids of a size, a reasonably good size, and if they're less than 50, the chances of it being on an abnormal side or an atypical fibroid, we call it, or a sarcoma is about 1 in 400 chances. So it's very important they monitor very closely by the tumor markers and also by MRI pelvis to find out how they look and how fast they are growing. If they're more than 45 to 50, because of this risk of it turning into malignancy or the normal looking fibroids on the MRI, there is a chance of it being malignant. 1 in 400 chances of it being malignant. It's better to get rid of them at an older age group.
Ma'am, another question I have is, there's a person who's worried if they would gain weight post hysterectomy.
That's a myth, actually. So, because after the hysterectomy, they don't walk, they don't do anything because they think it's a major surgery, they think, and then they stop working out. So that's when they gain weight. So after hysterectomy, they can just have the light start doing their normal routine work, especially the robotic and laparoscopy. Within 24 hours to 48, they're up and about. So they can just get back to their normal self within a week or so. And after that, after 4 weeks, they can just do the normal activities. They can get back to their work.
Ma'am, and the last question for the day to you is hysterectomy the only solution for severe endometriosis, or are there other treatments that the person should consider first?
Yes, there are medical treatments, there are conservative surgical treatments, and there are advanced treatments like hysterectomy. So medical treatments, there are medications which have come into the market recently called Dynogest and GnRH antagonists, which work quite well, and a simple oral contraceptive pill as well, which will help to a certain extent for it not to grow beyond whatever it is to contain the disease. These drugs can be used. And the conservative surgical methods are like when a merino coil, you can just do laparoscopically, remove the cyst, rectify, get the endometriotic deposits surgically removed, and then go ahead with the hormone releasing intrauterine devices, which will help to release the hormones locally and prevents the recurrence of endometriosis. If all this doesn't work, then they have to go for a removal of the uterus and both ovaries. We also have to remember the fact that the long-term endometriosis has got a small increase in the risk of clear cell carcinoma of the ovary. So if they have a very long-term endometriosis, it's better that we monitor them regularly and remove it appropriately.
Thank you so much, Dr. Sumana, for this enlightening and informative session. Your expertise has helped shed light on the various aspects of hysterectomy, from medical necessity to post-surgical recovery. To our audience, the recording of this session will be available on Apollo Hospital's website and social media channels. We also invite you to join our next webinar in the International Women's Day series, focused on other critical aspects of women's health. Happy Women's Day to you, all of you. Thank you so much, Doctor.
Thank you.